Hello, listeners. This is Janine
and Kristen
from Henrico Casa. You are listening to our podcast, Vigilant Voices.
Living life every day.
Hello, listeners. Thank you for joining us today. We always love to have you with us, but you joining us during Child Abuse Prevention Month feels especially relevant and worthwhile.
It does, because our purpose for these podcast conversations is to help prevent child abuse. And today we are introducing you to someone who shares that purpose with us. Her day-to-day responsibility is to protect children.
Yes, and that is why we consider her to be a fellow vigilant voice in our community. She knows about the challenges facing children and families and works to ensure no child faces additional abuse, neglect, or trauma.
So our guest today is Elizabeth Scholla, the Division Manager for Prevention and Protection at Henrico County's Child Protective Services.
Yes, and as such, she's a professional colleague of ours at CASA, speaking up for the welfare of children. So we're so glad to talk to you today. Welcome, Elizabeth.
Glad to be here.
Welcome.
Thank you.
All right, so Elizabeth, before we jump into just the work, we always love our guests to introduce themselves. So tell us a little bit about you and maybe your story in terms of how you got where you are.
Sure. So it's a little bit of a complicated question. I am a BSW, MSW grad, proud graduate of Virginia Commonwealth University.
Nice.
And I started off at VCU actually as a music major and on piano, and I thought I wanted to be a music therapist, which in the long run, I did not want to be a music therapist, but that's what I thought I wanted to do. And when I got to college, somebody that I grew up with, they suggested doing social work. VCU has a very good social work school, and they said, well, why don't you get your BSW, and then you can get your master's degree in something related to music so that you can tie these two things together. So I got my BSW, and in my senior practice class for my bachelor's degree in social work, Bobby O'Donnell and Brenda Sampe came and gave a presentation at my class. And Bobby is, for those who don't know her, she is she's now retired, but she works part-time at DSS and has had years and years of experience working in child protective services and child welfare. She's amazing.
Yes.
So she came to my senior level practice class and gave a presentation just about what it's like to work in child protective services, what the day-to-day life looks like, what sort of like team dynamic there is, and all these interesting aspects of the work. And I thought it was really interesting. And I was graduating in 2009, and it was the recession, and there were no jobs. And I was like, I'm just going to go to graduate school, and found the child welfare stipend program, which basically back then, I don't know how much they pay now, but they pay, back then it was $8,000 a semester towards your bachelor's or your graduate education, and with a contractual obligation that you work at a local DSS upon graduation.
I've never heard of this. Interesting.
Yeah. So I was the last cohort for the child welfare stipend back in 2000. I graduated in 2011 with my master's. And so then I was contractually obligated to work for a DSS, and I was hired out of Chesterfield doing child protective services, which is also where I interned at that time. And that program went away for a few years and then came back. So it's now back, and it is an interpretation of the 4U grant. And we get a lot of really well-trained child welfare workers from it. Right now, they interpret the grant really strictly where it doesn't apply to child protective services. It applies to prevention, to foster care, anything with our children who are currently in care. But so anyways, I started my work as a CPS investigator in Chesterfield, and I loved it. I was passionate about it. I still am passionate about it. It is fast-paced. It is working in a team environment. You work in a multidisciplinary team. You get to just interact with people and children in schools, in hospitals, in the public. You touch so many different varieties. It's never boring, sometimes a little overwhelming, but I got a flavor for the work that I really enjoyed. And then I moved from Chesterfield to Henrico and was an investigator in Henrico for several years before being promoted to the supervisor over our hotline for child protective services and adult protective services. And then over to CPS supervisor, and now to division manager. I haven't fully started my position with division manager, so I'm still very much in the trenches of being a CPS supervisor. So that's kind of how I got here. I am married to my high school sweetheart. I have 2 kids. I have a 4-year-old and a 7-year-old. Having kids and working in child protection has been an interesting experience because it drastically changes your perspective on things.
Right. Sure.
But I love the work. I find the day is never boring, and time goes by so fast working this kind of line of work.
Yeah.
That makes total sense.
Yeah. Thank you for sharing all of that.
So yeah.
Can you, just as you're talking, I know listeners, if you're like me, there's like acronyms and things and letters, and tell us, like, DSS, Department of Social Services, CPS, Child Protective Services, how does it all kind of fit together?
Sure. So in Virginia, Child Protective Services is located within the Department of Social Services as a statewide agency. It's different state to state. There is Child Protective Services is a federal thing that happens all over the United States, and it comes out in different program areas in different states. But in Virginia, it's specifically housed under the Department of Social Services.
Okay.
And in Child Protective Services, there's a continuum under the child welfare umbrella. So you have, in the beginning, you have CPS, and you really have the hotline. You have intake. You have when people call and make a report. And in Virginia, we're locally administrated but state run. So we do have a state hotline that takes reports at all times and overnight, but we also have a local hotline that functions during business hours.
Okay.
So we get the information locally, and we get it from the state, and then it's transferred to the unit for Child Protective Services, depending on criteria that it meets. And then across the continuum of child welfare in CPS, we either transfer the case to something that we call our in-home unit, which is also in Henrico, we call it family preservation, because they get reports and cases from a variety of different places. So CPS, like, let's pretend a report was made to the office. It's validated, it's assigned, a CPS worker investigates it, and it's determined the family needs some additional assistance. We would transfer it to in-home services, and they can monitor without a timeline of when they have to close it for a period of time and connect the family to services to reduce the risk in the home. Sometimes in CPS, the risk is too high, or we feel that there is an imminent threat to life, health, or safety, and we end up removing children and placing them in foster care. So we kind of skip over in-home and go to our foster care end of the continuum. We have a foster care unit in Henrico, consists of 2 units, and there are about 14 positions, I believe, in our foster care unit. And inside there, it's broken into 3 different parts. You have regular foster care, you have adoption, so children who have been freed for adoption, and you have independent living. And independent living can service foster children up to the age of 21, which is really cool, in my opinion, because I know I wasn't ready to be an adult at 18.
No.
So I can't imagine some of our kids were like 18 too. So that's kind of the continuum of child welfare.
So I'd love to hear you talk a little bit more, because we've seen this, I think, as a very good shift over time. Tell us a little bit more about the work that you all do within family preservation, because I think we hear CPS in the community, and sometimes it immediately goes to, we're doing removals. These are children that are all unsafe in their homes. And it doesn't mean that there, may not be some families that are having some struggles and dealing with a lot of barriers. But what does that preservation unit, and what does that look like that you embody every day in your work at CPS? Yeah.
So our preservation unit, and just kind of the overall mentality in our child welfare division, is that children really belong with their families, that we have better outcomes with their families. Foster care is not a place to be raised by children, or to be raising children. The foster care numbers, what we just know from the data, is not great. Foster care, if kids turn 18 while they're in foster care, 25% of them end up incarcerated, 25% of them end up homeless. So we want them connected with their family. And even when they turn 18, a lot of them go back to their family. So if we don't focus our efforts on that side of the house, it's just like, what are we doing? Our family preservation unit has been making huge efforts. They're working with something called motivational interviewing, which is an evidence-based practice that helps make real change in families, and they try to support families in all kinds of different ways. We are case managers, so we kind of sit gather all the services and put them in place with the family and then monitor and make sure that they get what they need. But family preservation workers, sometimes we're buying emergency groceries for families. We do basic day-to-day tasks, driving them to court, making sure that they can build up their own network of support when a crisis happens, having real conversations with them about their mental health, about the really hard things in their life, and then basically kind of forcing them to recognize when they need to reach out to their family members when they don't necessarily want to. And we've made a huge effort to kind of front load a lot of these things into CPS, where CPS is very crisis driven. So the CPS case happens because we respond to an allegation of abuse or neglect. We are not prevention. We can't get involved because something might happen. We get involved after something does happen.
Right.
And so when we come out, we front loaded it drastically in Henrico, where we have developed a team that we call it EFFT, which is Emergency Family Finding Team. And it's also a little tongue-in-cheek because it's pretty funny. And we pull these people together when we have a serious crisis where a child, we're worried we're going to end up having to put them in foster care. So, for example, because this is really high level, and I like to think of specific cases so that you guys understand what I'm talking about.
Absolutely. We love stories.
So if we have like a substance-exposed baby, so a baby who's born positive for drugs, and frequently they experience withdrawal when they're born positive for drugs. And say that parent is homeless and they've been living in hotels, and there's some concerns about prostitution, or there's some concerns about things going on in that environment. Sure. We would initiate an emergency family finding team, where we reach out to our FPM, which is a family partnership meeting, coordinators, and they run system searches to look for extended family members of the people we're involved with, and then we just start calling them and telling them what's going on and front loading, hey, you have a family member who's in crisis and there's a tiny baby involved in this. Right. We don't want to put them with strangers. We don't want to separate them from this group of people that might not even know that they exist. And so we have a team of people that surrounds that investigator, because the investigator is out there at the hospital talking to mom, seeing the child, talking to the nurses about what the treatment is. And then the people back at home office are making the phone calls to relatives, giving as little information as we can legally.
Confidentiality.
But to say, hey, can you come to this meeting where we can all sit down and talk about the process? And so we front load it in that manner so that we have the time to come to a family partnership meeting and have a good meeting. And then if we do end up in a position of foster care where we don't have any option but to remove the custody of that child from a parent, we have placement options at the table who are already in that family. So the state of Virginia DSS has really pushed for this no stranger foster care and pushing kinship efforts. And I'm really proud of Henrico because we started this before the state even really made it so much of an initiative. And because of this front-loaded work that we've done, our foster care numbers, we are at between 33 and 38% of our children in foster care are with their family. They're in foster care, but they're with their family. They're in a kinship placement in foster care. And I like to think about it, I talk with my workers about it too, where there's a huge difference, especially when it's not a baby that we're talking about, but let's say we have a second grader or something, and CPS comes and picks them up from school and is removing them and putting them in foster care, but then just driving them to grandma's house.
Much
and
different
so that child has no idea. They're just like, I don't know what's going on with all this, but I know I'm staying with my grandma.
So much less traumatic.
And it's just... it's so much more in the best interest of children. We have better outcomes long term. We're not wanting to separate families from each other. Families are complicated. And they deserve to have all of our efforts put into making it so that they can be with their children.
Thank you for sharing all of that.
That's a great explanation. And, thinking of kinship care, I think just practically you can see why it makes sense, right? But are there outcomes that are different? Like, what would you share about how this changes kind of the future of the child in a better way?
I don't know that we have the existing research yet to see the fruits of our labor in the long term, but we do know the outcomes in foster care are not good, and that the outcomes are better when return home is achieved. So if we put more effort into that return home and more effort into supporting those families of origin, we'll likely be able to see the fruits of our labor probably in a few years, once we have kids who have achieved some stability. And we're still figuring it out. And it's a huge shift, because I know from when I first started in this field, there were a lot of people who were very against making family members foster parents with this mentality where it's like, you should just be able to do this on your own, and it's not realistic. If we have to come in and provide assistance, how is this providing permanency to the family? And so there was a bit of a cultural shift to say, no, how is grandma any different from somebody who just decided to open their home as a foster parent? Grandma's doing it specifically for her grandchild, but just because she needs daycare assistance or she needs support in that manner, it doesn't mean that she is not appropriate or that she is not somebody who can't do this in the long term.
Yes,
Exactly.
and grandma has a cultural connection and a family connection, all these other benefits.
Yes, the rich connection to keep this child with their family, and that is what's always most important, and what we also know from research as being what the outcomes are best for children in general.
Yeah. No, that's great. Elizabeth, you and I go back. We've worked together for a long time. So, we appreciate you and your entire team over at Henrico Social Services. And we absolutely recognize that there is an emotional toll, that you all are dealing with every day, but you keep showing up. So we want to thank you for that. But what motivates you? I mean, we can tell, and I can hear your passion, and I've known that for many years. But maybe whether it's a motivation or just, what's your vision for healthy children and families in our community?
So I would love for my job to be obsolete. Yes. That would be amazing.
We say that all the time. Yes,
I don't know that we're ever going to be able to achieve that, but I appreciate people, and I appreciate the complexity of the human condition, and that kids are resilient, and parents are not all bad or all good. Nobody is all one category or another. And the thing that really motivates me right now, honestly, is my team. I have an amazing team of investigators, and I'll just free advertising here for if anybody has their master's degree or any sort of experience in child welfare and you want to come work for my team, please do. We support each other. We have each other's back. The people who work under me have a passion for this job. That's why they do it. And they support each other. Like, we go through very difficult things. The vicarious trauma is real.
Sure it is.
And having a group of people who is not afraid to talk about the hard things, and having a group of people who can be there for each other with those hard things, it brings your life into so much less of a surface level conversation. The depth and the meaning is really there. And I think that's probably what drives me to stay in this kind of field. I do feel like it's a calling. It's not the sort of thing that you just go into.
Yeah, not everyone might be
because, money is a motivator or things like that. My motivator is I feel like I'm making a difference. I feel like I have a purpose. I feel like I can be an agent for positive change. It's hard sometimes to feel that when it's really hard, but that's the why that I come back to. Like, why am I doing this?
Yes.
So
Thank you for sharing that.
Without a doubt, you are an agent for change. Your entire team, like, we consider you all fellow Vigilant Voices for kids in the community. We like to leave our listeners with a call to action, and it can be something really simple, but we know we're not all going to go into this line of work. We all aren't going to be Elizabeths in your role, but we can still be doing things for children and families. Is there anything you would throw out there that you would leave us with as a call to action? Yeah, well, there's a couple things I can think of. So we have in Henrico, we have our faith partners is what we call them. It's a community of, I believe it's mostly Christian-based religious affiliation, and they have taken on the cause to support our staff in a way that I haven't seen before. And we had Anna from Fort Richmond on the show last time, and she told us, so greatly appreciate. Like, they bring us treats on Friday mornings. They just remind us that we're doing the good work. They send thank you notes and things like that. And I just can't. The clientele that we work with don't always appreciate the work that we do. Or don't understand all of the complexities. The complexities of it, and they see us as the adversary. We work really hard to help,
build that rapport and connect with people, and that we really aren't their enemy, but we don't feel it very often. And so in my position as a supervisor, I feel it more for my staff on some level. So I would encourage any way that you can show appreciation for your local DSS for the work that they do, which is pretty thankless, would go a long way. And if you're thinking about the children specifically, I would encourage you, if you want to be a foster parent, reach out to, we are always in need of foster parents, even if you just want to be a respite foster parent where it's like, I could take a kid for a weekend.
Yeah.
That is huge.
Yeah.
And, just taking on a little bit at a time.
Yeah.
Love that.
Definitely. Thank you so much for hanging out with us.
Thank you for being with us.
Thanks for having
appreciate it.
me.
Yeah.
I appreciate it. Thanks for all that you do. We love CASA. So
We appreciate it. Yay.
Awesome. Thank you for listening to Vigilant Voices, Henrico Casa's new podcast. We have a vision for all children to live in safe, healthy homes. You can help us make that happen. Tell a friend about our podcast and find us on social media.
I believe in the better days.